myself. My name, as I mentioned, is Janhvi Patel. I lead digital ventures at MSK, where I manage business development, commercialization, and tech transfer of their digital data and diagnostic assets. In this role, I primarily have responsibilities for strategic partnerships, licensing, joint ventures, and spin-outs. I also want to take a moment just to thank our sponsors, Call Doctor, which is a solution to share, publish, and optimize physician on-call schedules. So with that introduction, I want to welcome Mary Ellen and Christine. Thank you so much for joining us today and talking about your experience with RememberStuff. Mary Ellen and then Christine, could you tell us a little bit about your background?
Sure. First, I'd like to say thank you very much for the invite to come in and share our experiences in developing and putting through into the market RememberStuff. I myself grew up in New York City, and but I have lived my adult life for the last 35 years in Minneapolis. So I consider myself freeze-dried most of the year. My experiences include I was trained to be an RN from St. Vincent's Hospital in New York City. I returned after 10 years of working in the hospital in various venues. I went back to school at Suffolk University and got my BS in business, and then turned around, and when we moved to Minneapolis, I went to the University of St. Thomas and got my MBA in healthcare administration. I've retired after 35 years as working as the Director of Quality and New Product Development at United Healthcare in Minneapolis. And during that time, I always dabbled in working at a nursing home locally, just to keep my hand in what was the latest thoughts about standard of care for elders. And then I retired after 30 years at United, and I joined my sister-in-law, Christine, here in Indiana in 2016. To add my clinical experiences and my business background in healthcare to the development strategy for RememberStuff, which we were getting ready to move from concept to production. Christine?
My background is more in the math and engineering side. I graduated from Purdue in 1970, so I am old. And I went to Cummins Engine in Columbus, Indiana, and I worked in their R&D department on their digital math libraries. This is just when digital computers were coming on, and all of their simulation work had been done with analog computers, and they were getting into hybrid. So that was a fun job. I worked there for 12 years, got to work in production, quality, corporate. I got to work, all of the different places within the company. Then I left in 1982 and I joined two other women in Columbus that had a software company. And I stayed there 10 years. We built that company up. And I wanted to actually have a physical product. So I started a company called Cybermetrics, and that was 1992. And by 2001, we almost went under. And the reason I'm telling you that is I learned a ton about focus and really focusing on the product, being the best in the market and bringing high value to our customers. And how do you manage a company that went from 34 people to 10 in a short period of time? We also learned the value of having and developing flexible technology. And this is the basis of what we're doing with our technologies, especially with RememberStuff. That's the core of it. It is designed to be flexible, not only for the market, but in partners that we can integrate technology with. So we didn't want to be in the business of developing medical devices or wearables or monitoring the room, but we wanted to have a system that we can integrate those.
That's fantastic. very strong combination of experiences between the clinical perspective and then the software perspective and combining them. And I really appreciate what you said around creating an ecosystem where you can combine a lot of these solutions and connect them to provide that coordinated care. Christine, what motivated you to get into the health tech ecosystem?
I don't know if you can see this picture or not, but this is my this is my personal motivation. Up in the top left-hand corner at Cybermetrics, it's Jack Reesters on the right and our first employee, Wes Eastwood, and that's our first product, Roadrunner. And Jack agreed to start an LLC under our engineering company that would address personalized needs in the healthcare market. Jack had a rare cancer. Whenever he would leave Columbus and go to Houston or the Mayo Clinic, he would have to take a ton of records with him. So the concept for DocStuff started with that. Also, down in the left-hand corner, that's my mom and my dad. And my grandmother had dementia. My mother had dementia. She didn't know who I was. My dad, he had kidney failure, so I was, bringing tons of things, with me to the doctor, and they lived 1,200 miles away. On the right-hand side, that's my brother and his new wife. He's in a long-term care facility. He's developmentally disabled. But all of this wrapped up, and then Mary Ellen and I took on caring for our mother-in-law who also had dementia. And I tell you, we had to be in this from a personal standpoint. The reason we did it under the engineering company is that one of the reasons that we were struggling in 2001 is we were only automotive, a very niche-y. So we figured we had an approach for design and we had a technology that we then decided we wanted to diversify our market and get into wellness and healthcare.
Right. Thank you. Well, having kind of gone through this experience, been so close to this, both personally and professionally, what have you seen that has changed over the last 10 years? This is both Mary Ellen and Christine.
Well, I think from my point of view, as looking at it through the eyes of the nurse, I think that two things have happened in the last couple of years. First, I think that the world of care delivery has switched, and the doctors and the doctors' practices are beginning to realize there's a role for the patient themselves and their caregivers, involving them in the care services that they are about to prescribe for a treatment plan for the patient. And in the past, they really were excluded from any kind of knowledge as to why the doctor was ordering things like, a new change in medicine or a change in diet. And I think that by adding them to the picture, that they will increase compliance with following the rules, and that they will engage the patient and the family to work towards a better health outcome. So I think that's a big change in the way healthcare is being delivered. But the pandemic and the lockdown of not being able to get out and visit, I think that it has forced the entire nation to look at technology as a way to overcome the isolation of being alone in a facility and not being able to visit. And I think that families and elders are much more open to testing out technology. So when we first started talking about RememberStuff, and that we used the word elders, computers, and a new program for them to follow, it was like immediate reaction from the audience was, my mom can't change the television channels with the TV remote. How is she going to operate a computer? And today we find that very much different, that people are saying, well, we've been using Zoom and Skype for an entire year, and they do pretty well with it. So I think those are the two major changes, is that we have involvement now from the families in how care is delivered, and it's a good involvement, I think.
And I just add one thing. The fall and winter before the pandemic hit, we went to 5 assisted living trade shows. We drove to all of them, which were crazy people. We were in Orlando, Denver, Utah, San Diego. I know I'm missing one, possibly. But anyway, we learned a lot about care, what's needed in care communities and the whole range of care communities. And we were demonstrating our person-centered technology for an in-room type of technology. And that is fairly new for care communities. And there was a lot of excitement. So we got on the road in January, February, and we were starting to follow up on communities that were interested. We were signing up a community in Los Alamos, and we were, I had this all mapped out, and the pandemic hit. And so what we did then is concentrate on accelerating our research into the area and the development of the product. But we're so excited about hitting the road again. And like Mary Ellen said, that I think there's going to be a different appreciation for technology, person-centered technology in the care communities as well as in the home.
Well, I just want to pause on that experience. That seems like an incredible experience to go to all of these different types of communities and drive there, especially. Just curious, what were some of the most common gaps in care that you found?
Gaps in care? Well,
yes.
Care communities are all over the map when it comes to what they offer. We were in a brand new facility in Utah. My gosh, my son works for the company as well, and he did all of the driving. So we were in there and he says, "Mother, this is where you're going." By the time we left, it was so nice, but they only had 8 residents there. But you see a whole range. I grew up going to, they called it the county home when I was young, but the care communities there's a wide range. And if you're in like a long-term care facility, maybe there are no more families that are around or nearby that can communicate with these people. So I have, Mary Ellen and I were just a wonderful match, because I have the hat of being able to put myself in the place of the person with dementia, the person that's developmentally disabled or is, has other health challenges. And so I have that hat on, and so I can feel what they're feeling sitting in a room, and there's no real time sometimes to meet what their needs are. And you don't want them just sitting in front of TVs. And with the lockdown, or even with flu, I mean, the facility that my brother and his wife are in, that if flu comes through the facility, they lock that down. You can't have visitors, but it's for a short period of time. But by being able to have a system like ours that understands, learns from the person what they like, and engages them without it being another, TV type thing. We want to engage positively and have purpose, bring content and purpose. And I'm talking too long. That's it.
That's it. So what is RememberStuff?
Mary Ellen, you want to take that? Or?
Sure. RememberStuff, in its definition, is a room or facility or a home kiosk with customized hardware and software that enables secure directional communication between the caregiver, the facility staff, the family and friends, and the senior with dementia. So it is basically taking all of the information that you know about your particular elder that has purchased the device and is built for you, and you're putting in information around a calendar to help them understand what is going to happen today. And it can be a typical calendar by, you know, anniversary and appointments and those kinds of dates, or it can be what's going to happen at 8 o'clock versus 9 o'clock versus 10 o'clock. Take your medicines at 10 o'clock. At lunch, you're going to, at 12 o'clock, you're going to prepare lunch and sit and eat it. So those calendars are a way for them to stay grounded in where they are at this moment, in this daylight, at this date. And then we go to the remember screens, which are what I consider, the calendar is the action items of the day. And the remember screens are set up in two theories. One, they can be reminders or cheat sheets on how to do something. So if you've placed a new coffee maker in mom's apartment, and she gets up one morning and sees on the calendar that she's supposed to make coffee and sit and have her cereal, and she has no idea how, she doesn't remember how to start the coffee maker, she can go to the remember list and you can have created a simple direction guide. This is step one. You plug it in, you turn it on, you put the water in, you put the coffee in, you know, those kinds of directions in simple terms. And we have found that once the person begins to read the cheat sheet, then you turn around and it triggers. Of course, I remember how to do that. I don't need to read any further, but it gives that sense of being in charge and in control. But the Remember Stuff list can also be a way to support your memory. So you can have pictures of the family, addresses, history of the family, so that they can go through and kind of remember who all of the people are in their life, if that's a memory that's faded for them on a particular day. Or it can be articles of interest so that they don't have to watch television all day. They can actually go to the Remember screens and read and educate themselves on old hobbies or new subjects of interest. So it's a wide range, and it's really important that the family who knows this person actually helps fill out the Remember screen selections. And Chris, can you explain a little bit about the new content library?
Yeah, mid-March, we are launching our new smart content library. And before this point, that we had preloaded content, or the facility or the family would have to put all the content in. We're very excited about this new content library. We expect to have at least 50,000 items of content, from video clips to pictures, and that we're able then to take that content and even arrange it such that we even bring more value in terms of quizzes and games that we'll be bringing to the users. So content is king. They're going to be able to search the content library just like you'd search like an internet, but our system is totally locked down. We do all of the software updates. We do all of the security updates, and we don't allow the user to get out on the internet. It's totally a safe place for that user to be.
So the basic showing here is the activities page is the third column of structure for the program. So calendars first, then remember screens, then the activities, which is a group. They can listen to music, they can listen to faith programs, they can do quizzes, they can do activities, they can play solitaire. There's a whole wide range of different things, and we're constantly reviewing and adding to that to make it a place where they can be engaged in different things to keep their mind active. And the last column of the program is the messaging side. And there we can do text messaging back and forth. We can do constant video, meaning that you can send a video and it can be recorded and held there, and the person, the elder, can play it many times over until you yourself delete it. And we just added at the in the middle of the year, a live video. So similar to a Zoom call that can happen between the caregiver and the person 24/7, so that in a facility without the help of staff, they can have live interaction with family at the bedside consistently without bothering the staff. So it's a simple to use, simple to access, intuitive program that is built on, if there's something that needs to get in the program, it has a place in one of those 4 screens. So the 4 screens are the actual foundation of that program.
Okay, thank you. I do like the simplicity of having everything kind of bubble up to 4 key kind of efforts, just to keep things simple, but then build upon them. That's fantastic. So what is your vision and your goals for RememberStuff?
Chris, you want to start?
Well, we do not have a strength in communicating the value to the market. And last month, we did hire a consultant in this area. And we truly believe that we are so focused that everybody in our company, they joined our company because they care about this, you know, the clients that are out there. And so we're going to be doing a better job at communicating value and getting out there, and then finding a bigger partner, because we're really a technology company. We have this base technology that we can configure actually to fit into other companies'
Inventory.
realm of expertise, and that it could even be branded underneath their names, different pieces of the technology. Some of it stands alone. But you know, the goal is to get it not only in the US, but to have a global market for this, and that we have RememberStuff and DocStuff and the content library. And we have a creativity lab that it comes with the RememberStuff if we're applying it for healthcare, like for the Navajo Nation or the maybe the Middle East, where diabetes is so rampant. So there's a lot of ways to apply this. So we're looking for partners right now, and that's kind of a non-answer, isn't it?
Well, you know, to kind of sum up, we thought that this would be a great opportunity to put the word out. We're looking for building up brand recognition in the marketplace. We would like it to be that when you see the Target circle, the red circle, everybody knows you're going to talk about Target. We would like to be able to publish the elephant face and have everybody say, oh, that's RememberStuff. That's that device that's out there to help people care for people with dementia. And we, because of the pandemic, we've been on standstill waiting to find that partner facility. So if anybody in the audience has any desire to find out more about what we hope to achieve, we are looking for a pilot partner, somebody that we can go in and work with to see if indeed we can put the value of RememberStuff for a facility into words by working with them.
All right. Thank you for that. And yes, for folks in the audience, if you have any comments or questions, please feel free to share them. We would be happy to take them during this discussion. So that being said, so how is RememberStuff maybe different from some of the other companies in the H-Tech space?
Well, the RememberStuff product is very different in the ability to configure it for different groups out there. I mentioned if, you know, the diabetes maybe in a particular culture. So we can configure this to be a family healthcare education system. And we don't see anybody out there doing that. In the consumer market, there are a lot of different solutions out there for engagement. The problem with that is that that's a solution that may be small and they keep losing it. I mean, you lose phones, you lose tablets, and that is a solution for a moment in time, not a solution that adjusts to where you are in your journey. So with our solution, you only need, one kiosk or one desktop or a tablet, and that can carry you through the entire journey. There's another company out there that is doing in-room, and they've been in this business a lot longer than we have, and it's a really good company. And so it's always nice to have a competitor in the same space. So
absolutely. And it seems like it's a extremely interesting time. It's always exciting when a couple of different factors from the market kind of come together and create an opportunity. You have a growing need. You have this upsurge of, wanting to be connected through digital means. And then you have all of these care facilities and, kind of improving their quality and outcomes. It seems like it's a perfect storm for RememberStuff at this time. And so for folks that are online and that are interested in kind of helping or working with you, could you give us a little bit more information on the company itself? What stage of development are you? How large are you? Maybe what's next over the next year?
Well, we're a small company. Like I said, that we're focused on the development side. But we have expertise that we know how to put in place, like the fulfillment. Our director of programming, he has extensive experience not only in that, but also in joint venture development and that kind of thing. And we have 2 fulfillment partners. Hewlett Packard's one. They have told us that they can ramp up to 10,000 units a month if we, start selling that many. So we have support there. We have Hexagon. They're in Huntsville, and again, it's an excellent company, and they handle all of that, the help desk as well as the tablet side and the hotspots. Our technology, we have a strategic partner in Axia TP, and that we also bring in technology expertise like an AI from Data Art and Timuron Group. So where we need extra, we have a master service agreement. We own all of the technology. We have backups of it. We have how it's developed, how to maintain it. And so we, rather than having the company be, 50 to 100 people, and we have a lot of software people and we're doing our own fulfillment, we went to experts in that area. When I sold my company in 2016, I took the funds to invest here. And that's, I had 54 people. I had India, UK, China, and I didn't want to start there.
All right, fantastic. Do we have any questions from the audience? We have about a minute left. Just wanted to open it up to folks.
And one question, Carol. Carol was asking, what do you do better, differently than your competitors?
Well, when we were at these shows at the end of 2019, boy, our competitors, they had content, and we really didn't have a solution for the content. And now we have spent the last year developing a Knock Your Socks Off content library that it has a lot of different structures to it that brings value to the company. And then we are really diving deep on the dementia side and doing research in that. Not that they wouldn't be, but we are working with some fantastic universities in this.
And that.
Thank you so much. Thank you. I just want to thank you again, Mary Ellen and Kristen, for taking the time to speak with us today and joining Women Help Tech Wednesday. And we hope to see you in our next event, one on February 17th, and the next one will be on February 24th. And again, we just wanted to thank our sponsor, Call Doctor, and hope you guys enjoyed the discussion. Please feel free to reach out to HitLab if you'd like to connect. Or feel free to connect with Mary Ellen and Christine directly. Thanks, everyone.
Thank you.
Thank you for having us.